Aspergillosis is a fungal disease commonly found to cause pneumonia in young chicks, hence it was frequently called brooder pneumonia. Aspergillosis is caused by a fungus called Aspergillus. This fungus can grow in the environment including in feed, bedding and in extreme situations in animal tissues. The fungus produces spores which are spread in the air going on to germinate, therefore completing the fungal life cycle. Normally the environment contains some Aspergillus spores which when inhaled by healthy adult birds and mammals are harmless. However, there are a number of factors which can tip the balance in favor of the fungus. One, an environment containing high levels spores can overwhelm the body's natural defenses, which causes the disease, such as day-old chicks under brooders, hence the term brooder pneumonia. 2, birds with other diseases are more vulnerable to infection. 3, environmental factors such as extreme cold, high levels of ammonia or high dust levels can stress the chickens, lowering their immune system. This reduces their ability to fight infection, which increases the chances of developing aspergillosis. 4, antibiotic medication will result in a greater risk of development, as antibiotics kill all bacteria on the surface of the respiratory tract, leaving more room for fungal attachment and infection. Aspergillosis affects chickens, turkeys, ducks, penguins, game birds, waterfowl, etc., worldwide. The infection has an incubation period of 2 to 5 days. Morbidity is usually low, but may be as high as 12%. Mortality among young affected birds is 5 to 50%. Transmission is by inhalation exposure to an environment with a high spore count. There is usually little bird-to-bird transmission. Spores are highly resistant to disinfectants. Signs: acute form, inappetence, weakness, silent gasping, rapid breathing, thirst, drowsiness. Nervous signs: rare. Chronic forms: ocular discharge, ocular form only, wasting. Post-mortem lesions: yellow to gray nodules or plaques in lungs, air sacs, trachea, plaques in peritoneal cavity, may have greenish surface. Conjunctivitis, keratitis. Brain lesions may be seen in some birds with nervous signs. Treatment: environmental spraying with effective antifungal and antiseptic may help to reduce challenge. Amphotericin B and nystatin has been used in high-value birds. Supportive care: isolate the bird from the flock and place in a safe, comfortable, warm location, your own chicken intensive care unit, with easy access to water and food. Limit stress. Call your veterinarian. Itraconazole, 10 mg per kg administered orally, twice a day. Amphotericin B, 1 mg per kg administered IT, Tide plus 1.5 mg per kg 4. Copper sulfate, 1 gram per 2 liter water twice daily for 5 days. Respiron liquid, 1 liter for 5 days. Prevention: 1. Minimizing use of antibiotics and corticosteroids. 2. Ensure coops are designed with good ventilation, to ensure regular airflow, with or without an open window. 3. Remove moldy straw or hay. 4. Frequently move feeders and water dispensers to different areas to prevent growth of mold. 5. Conduct regular air quality tests. 6. Reduce the potential for condensation on cold surfaces by adding insulation.